Hello everyone, I am Dr. Sandhya Rani, Senior Consultant Obstetrics and Gynaecology Department, Aster Women Children Hospital, Bangalore. Today we are going to discuss about a procedure called HSG. So as we all know, the number of cases of infertility are on the rise. Most common consultations in the gynecology department are for fertility related issues. It has been observed that out of 100 couples who come to us for fertility assessment or for infertility related problems, we find 30% of the cases have some deviation or observation with the women, 30% where the male factor comes into picture, and about 30%, 30 to 40% of the cases where everything is fine with the male and the female partners, but it is reason unknown. So when we start evaluating the women, so we start checking their hormones, their basic blood work. We do the ultrasound to assess the uterus, the ovaries, the ovulation. But one of the most important parts of the female reproductive system is the fallopian tubes. So these are two tube-like structures on either part of the uterus through which the egg transports, and that is the place where the sperm and the egg meet and fertilize. So if there is an obstruction in the tube, fallopian tube, there could be a problem getting pregnant. So how do we assess whether the fallopian tubes are functional? Functionality means they should be open and they should also function with their cilia, transporting the egg and helping it meet the sperm. So there are different ways to assess the tubal patency. One of them is the HSG or Hysterosalpingography. So this is an X-ray test usually performed between the 7th to 10th day of the menstrual cycle. The reason being that the ovulation does not take place before that, and we know for sure that the woman is not pregnant. We also ensure that the bleeding has completely stopped because this test involves injection of a dye and we do not want the blood to go back into the pelvis. So 7th to 10th day after the bleeding is completely stopped, we call the women for the procedure. It takes about half an hour for this test to be performed. So we ask the woman to have a light breakfast at least 2 hours before the procedure. A painkiller may be prescribed to relieve her of the pain, and we pass a small cannula or a metal tube or a plastic cannula through the cervix and inject a dye. So the movement of this dye through the uterus and the fallopian tubes is captured through series of X-rays. So this tells us about the internal part of the uterus, where we see whether the uterus shape and structure are normal. Is there any septum? Is the uterus in two parts like what we observe in a biconjugate uterus? And as the dye goes into the fallopian tubes, we can identify if both the tubes are open, one of them is blocked, and if it is blocked, where is it blocked? One functional tube is sufficient for a woman to get pregnant. But if we observe that both the tubes are blocked in this test, then we may have to go for a corrective surgery to clear the blockage, or the woman may be suggested to go for IVF procedure. So are there any side effects of this procedure? No. Minimal pain may be there, that is why the painkiller is prescribed in advance. In case the woman perceives the pain a little more than expected, we give a painkiller on the spot. Very rarely there could be an allergic reaction to the dye which is injected, so we keep all the anti-allergic medicines on standby when we perform this procedure. So what are the situations where the tube can be blocked? If the woman has previous pelvic infections or previous surgeries on the fallopian tubes, or if she suffers from a condition called endometriosis, these are the situations where we find that the fallopian tube may be blocked. If both the tubes are blocked, we've observed that most of the dye backflows and we refer her to a fertility specialist for further care. So is this only a diagnostic test? No, it has also been observed that this test helps us clear minor blocks. Suppose there are dead cells or a mucus which was blocking the fallopian tube till the test is performed. The injection and the movement of this dye clears off this tube, and the fertility rates post the test are better than pre-test. Are there any other ways to assess the patency of the tube? Yes. There is a similar test called SSG or sonosalpingography, where instead of a dye, saline or distilled water is injected and the assessment is done through an ultrasound. That is not as specific as a HSG, but some doctors prefer to do that. The final way of testing the tube is through a laparoscopy combined with a hysteroscopy, which is like the sure shot and the most definitive test. But that is an invasive test and there is anesthesia involved. So as a preliminary assessment, HSG always has an advantage. So most of the women ask, how painful is it? It is mild to moderate pain, can be managed with painkillers. It is not as scary as people describe it to be. And can it be done under anesthesia? Why not? If there are women who feel that they do not want to experience that kind of pain, they can get the same test done under anesthesia as well. So HSG is a diagnostic, sometimes therapeutic test to assess the fallopian tubes in cases of infertility. Hope this helps. And in Aster Women and Children Hospital, HSG test is performed on all days. So you can reach out to us if you want to know or if you want to undergo this test. Hope this information helps. Thank you.